All right, let's jump into it today. We're going to be taking a deep dive into blood work, specifically coagulation tests. You ever wonder what those numbers on your results actually mean?
Well, they're really important, these tests. They give us a window into your blood clotting.
Yeah.
And that's not just important for people with bleeding disorders, you know.
Right.
We use them all the time, these tests,
Oh, yeah.
to prep for surgeries, to make sure things are, managed properly with medications like warfarin or heparin.
Exactly, because those medications can really thin the blood out, right?
Mm-hmm.
And we want to make sure everything's kind of balanced. So we're going to be focusing on three key tests, the PT, PTT, and INR.
Right.
And those always sound so mysterious.
Yeah, they do.
Those abbreviations.
They're like, looking at a puzzle, but from different sides,
Yeah.
each one.
So before we even get into the tests themselves, maybe we should back up a bit.
Yeah.
How does blood clotting actually work? I mean, we all know it's essential so we don't bleed out, but the actual process seems pretty complex.
It is. It is complex. But think about it like this. It's like a three-act play. Act 1 is what we call the vascular phase.
Okay.
So your blood vessels constrict to reduce blood flow at the injury site, kind of like turning off the water main when you have a burst pipe.
Right, damage control. Makes sense. What's Act 2?
Act 2, that's where the platelets take center stage.
Okay.
These tiny little cell fragments, they rush to the scene and clump together to create a plug. They seal the leak.
So like one of those inflatable dams they use for flood control?
Exactly. Now, that plug's pretty good, but it's not quite enough to stop the bleeding completely.
Gotcha.
That's where Act 3 comes in, coagulation phase. This is where things get a little more complex. It's this cascade of reactions that leads to the formation of fibrin.
Fibrin, right. And that's the stuff that actually forms a stable clot.
That's right. It acts like a mesh net that reinforces the platelet plug and creates that barrier to stop the bleeding.
So it's like a care inside our body, each step building on the previous one.
Yes, I like that. And just like a dance can have different routines, the coagulation phase has two main pathways.
Okay.
We call them the intrinsic pathway. That one's triggered by damage inside a blood vessel.
Okay.
And then you have the extrinsic pathway, activated by external injury.
So two pathways, but ultimately the same goal.
Right.
Fascinating. So where does the prothrombin time test, the PT test, come into play?
So the PT test focuses on the extrinsic and common pathways of coagulation.
Okay.
It measures how long it takes for your blood to clot after it's been exposed to certain substances.
Okay. So if my PT is longer than normal, does that mean I'm more likely to bleed?
Well, it could mean a few things. A prolonged PT could indicate a deficiency in some of the clotting factors.
Okay.
The proteins responsible for each step in the clotting cascade.
And these clotting factors are really important when it comes to monitoring people who are on warfarin, right?
Absolutely. PT is crucial for managing warfarin therapy. Helps doctors adjust the dosage just right so they can prevent clots, but also minimize that bleeding risk.
I see. So it's all about finding that sweet spot. Are there any other situations where PT tests would be ordered?
Oh, yeah, for sure. It's also used to assess liver function. You see, the liver produces many of those clotting factors, so if someone has liver disease, their PT might be prolonged.
Right. So healthy liver, healthy clotting.
Mm-hmm.
I'm guessing PT tests are also standard before surgery, too.
Spot on. Surgeons want to make sure your clotting system is working properly before they operate, to avoid any complications during and after the procedure.
That makes a lot of sense. So how do doctors actually interpret the results of a PT test? Is there a specific number that I should be aiming for?
The normal range for PT is typically between 11 and 13.5 seconds.
Okay.
Anything outside that range requires a little more investigation.
So it's not just about knowing the number, it's understanding what it means in the context of a patient's overall health. Okay. So let's shift gears a little bit and talk about the partial thromboplastin time, the PTT. How does that one differ from the PT test?
So you mentioned PT focuses on external injuries, right?
Yes.
PTT measures the intrinsic and common pathways of coagulation. It looks at the internal workings.
Okay, so PT external, PTT internal.
Mm-hmm.
But they both ultimately measure how long it takes for blood to clot.
You got it. They just assess different sets of clotting factors. PTT is especially useful for diagnosing bleeding disorders, like hemophilia.
Because certain clotting factors are deficient in people with hemophilia.
Right.
Okay.
PTT can pinpoint which factor is deficient to help guide treatment.
So PTT is like a detective,
Uh-huh.
helping us uncover potential clotting factor issues.
Mm-hmm.
Are there any other scenarios where PTT testing would be helpful?
Oh, yeah. Absolutely. Just like the PT, PTT is essential for monitoring patients on heparin therapy.
Interesting.
That's another type of anticoagulant medication.
Okay, so both are important for managing that anticoagulation therapy, just with different medications. Are there any other uses for PTT?
Yes. It can also be helpful in investigating recurring miscarriages or blood clots.
Okay.
These can sometimes be linked to abnormalities in that intrinsic pathway.
Wow, so PTT has quite a diverse range of applications. But how do we interpret PTT results? Is the normal range the same as PT?
Not quite. For PTT, the typical range is between 25 and 35 seconds.
Okay.
Again, anything significantly outside of that range could signal a problem.
So just like with PT, it's all about understanding the normal range
Right.
and what deviations from that might indicate.
Exactly.
Okay, so we've covered PT, PTT, both are measured in seconds.
Right.
What about that mysterious INR, the International Normalized Ratio? What's that all about?
Right.
Yeah, I've heard that one thrown around, especially when talking about warfarin. What makes it different from PT?
Well, the INR, it's like the PT's cousin,
Okay.
but it's more standardized.
Okay.
So remember how we were talking about the PT test and how it's used to monitor warfarin?
Hmm.
Well, here's the thing. PT results, they can vary a little bit between labs.
Oh, really? Why is that?
It all comes down to the equipment and the reagents they use.
Oh, okay.
You could get slightly different PT results, even if your blood's exactly the same.
Huh. That sounds like a problem, especially when you're dealing with something as important as managing warfarin.
Yeah, you're right. And that's where the INR comes in.
Okay.
It was actually developed to overcome that variability.
Right.
It gives us a standardized measure, so it's consistent no matter where you go.
So INR is like a universal language for PP results.
Exactly.
So everyone's on the same page.
Yeah. And that's super important for patients on warfarin, right?
Right.
Because doctors need to compare those results from different labs, and they have to adjust dosages safely, accurately.
That makes a lot of sense.
Yeah.
So how does the INR relate to the PT
Right.
mathematically? Is there some kind of formula?
There is a calculation,
Okay.
but the important thing to know is this. The INR takes into account the patient's PT result, the lab's PT sensitivity, and a standard called the International Sensitivity Index.
Okay, that sounds a little technical. But the
Yeah.
bottom line is INR makes that warfarin monitoring more reliable.
Exactly.
Okay, good.
And because it's standardized, doctors can define a therapeutic range for patients on warfarin,
Okay.
usually between 2 and 3.
So what happens if someone's INR falls outside of that range?
So if the INR is too high, it means the blood's taking too long to clot,
Okay.
and that increases the risk of bleeding.
So they would lower the dose of warfarin.
Right. Now, if it's too low, that means the blood's clotting too quickly,
Okay.
and that raises the risk of clots.
And then they would increase it.
Increase the warfarin, exactly, to bring that INR back into range.
Okay, so it's all about finding that balance.
Yes.
Keeping it in that sweet spot.
Exactly.
Okay, so to recap, we've covered these 3 key coagulation tests: the PT for external injuries, PTT for internal injuries, and then the INR, the standardized version of the PT, especially important for people who are on warfarin.
You got it. Each test gives us a little piece of the puzzle and helps us figure out how well your blood's clotting.
And it's amazing how much information we can actually get from these tests. But I do have to ask, what happens if these tests aren't interpreted correctly?
That is a great question. These tests are powerful tools,
Yeah.
but they have to be used properly.
Right.
Misinterpretation could lead to the wrong diagnosis or the wrong treatment. And obviously, that's not good for the patient.
Right. Of course not.
Mm-hmm.
Could you give me an example of what that might look like?
Sure. Let's say someone's PTT is prolonged.
Okay.
Now, that could be due to a lot of different things, maybe a clotting factor deficiency, or they're on heparin. But if the results are misinterpreted, the patient might end up getting the wrong treatment.
So it's not just about looking at the numbers. It's about understanding the bigger picture, right?
Yes, exactly.
Their history, medications they're on, their overall health.
Exactly. It takes a trained eye. You have to
Yeah.
consider all those factors. That's why it's so important to have qualified healthcare professionals interpreting these results.
Absolutely, yeah. Well, this has been incredibly insightful. I really appreciate the complexity of blood clotting and the expertise that's needed to manage it effectively.
I agree. It's a fascinating field.
Speaking of evolving, are there any new advancements in coagulation testing on the horizon?
There are. A really exciting development that's come about is point-of-care testing devices.
Point of care, does that mean testing that can be done outside of a lab?
Exactly.
Like in a doctor's office or at home even?
Exactly. These portable devices are getting really sophisticated. They're allowing for rapid and convenient coagulation testing.
That sounds like a real game changer,
Yeah.
especially in emergency situations or for people who have difficulty getting to a lab.
Absolutely. It allows healthcare providers to make decisions faster and potentially improves patient outcomes.
What about personalized medicine?
Right.
Is that playing a role in how we're managing coagulation these days?
Absolutely. We're seeing this shift towards more personalized approaches to anticoagulation therapy. We're using genetic testing to tailor treatment to each individual patient.
So we're moving away from that one-size-fits-all approach.
Exactly. For
Okay.
example, genetic testing can help identify variations in certain genes that affect how people metabolize warfarin.
Okay.
This information helps doctors adjust dosages more accurately,
I see.
which reduces the risk of side effects.
Wow. So you're customizing the treatment to actually match the patient's biology.
Exactly.
It seems like a very exciting time to be working in the field of hematology.
It is, and it really highlights the need for healthcare professionals to stay up to date on the latest research.
Right, of course. So with all these new technologies, the increasing complexity of these coagulation tests, what are some essential skills for people who are working in this field?
Well, first and foremost, a solid understanding of hematology is crucial, and the coagulation cascade.
Right. You have to know the science behind it all.
Yeah.
What about other skills? Beyond just that technical knowledge?
Critical thinking skills are really important. And analytical skills
Yeah.
for interpreting test results accurately.
Right, because it's not just about looking at the numbers. You have to understand how it all fits together with the patient.
Right. And let's not forget communication skills, being able to explain these concepts to patients clearly
Yeah,
and compassionately. That's important.
absolutely. Building that trust,
Mm.
making sure they feel informed about their own healthcare decisions.
Exactly. And finally, I think a commitment to lifelong learning.
Yeah.
The field is constantly evolving, so healthcare professionals really need to stay curious.
It's incredible to think how much we've learned about blood clotting, yet there's still so much more to discover.
I know, it's a fascinating field.
Speaking of innovation, are there any emerging technologies or research areas that you're particularly excited about?
Oh, there are a few. One that I think is super cool is the research being done on bioengineered clotting factors.
Okay, yeah. Bioengineered clotting factors. That sounds like something straight out of science fiction.
It kind of is. For a long time, we've had to rely on donated blood plasma to produce clotting factors for people with deficiencies, like hemophilia.
Right.
But there are drawbacks to that method.
Yeah. I remember reading about the risks of using blood products, contamination, allergic reactions,
Yeah.
things like that.
Exactly. Bioengineering, it offers a safer, more sustainable way to do this.
Okay.
Scientists are now able to create clotting factors in the lab using genetically modified cells.
So we're talking about synthetic versions of these proteins.
Yeah, pretty much.
Wow, that's pretty incredible.
Hmm.
So what are the benefits of doing it that way?
Well, first of all, you don't have to rely on donated plasma anymore.
Right.
So that reduces the risk of infection.
Makes sense.
And you have a lot more control over the manufacturing process.
Okay.
So you can make sure the clotting factors are consistent and pure.
That's huge for people who rely on these treatments.
It is.
Are there any other kind of groundbreaking developments that you're seeing coming up in the world of coagulation?
Oh, yeah, there are. Another one that has people talking is gene therapy for bleeding disorders.
Gene therapy. Isn't that where they actually try to correct the genetic defect itself?
Yes, you deliver a functional copy of the gene into the patient's cells. That gene is responsible for producing the missing clotting factor.
Wow. That sounds revolutionary. Is that something that's actually being used now to treat patients?
Well, it's still in clinical trials for hemophilia, but the results have been really promising so far.
Right.
If it works, it could actually offer a permanent solution.
That would be incredible. I mean, it's so inspiring to see all these scientific advancements and all the new possibilities that they're opening up.
It is, and it shows just how important research and innovation are for advancing healthcare.
So as we wrap up our deep dive today on coagulation studies, what are some key takeaways that you want our listeners to remember?
Well, I think the biggest thing is to really appreciate how complex our blood clotting system is.
Right.
It's so finely tuned, it plays such a vital role in our health.
And we've seen how these tests, PT, PTT, INR, give us those insights into how that system is working.
That's right. They're crucial for diagnosing and managing so many different conditions. from bleeding disorders to medications.
And we learned that interpreting those tests, it's not always easy.
No.
It requires expertise, thinking about the whole patient, and knowing all the latest advancements.
That's a good point. This field is always evolving. What we know now might be different next year.
It's a good reminder for all of us to stay curious, keep learning.
Yeah.
Well, this deep dive has been fascinating. I feel like I have a much better grasp now of how my blood clots.
Good.
And why these tests are so important.
I'm glad to hear that. It's always fun for me to talk about this system that's often overlooked.
Well, folks, there you have it. Another deep dive complete. We hope you enjoyed the journey, learned something new along the way. Until next time, stay curious and stay tuned for more fascinating topics.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey, one step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.